Hello and welcome to Business Reporter's The Future of Work campaign. I'm Alistair Greener. How can we save our healthcare? In an age when the demographics of the developed world require more investment in hospitals, but the budgets are shrinking, how could we find a solution without compromising? Advantech, a developer of IoT, believes that when we're trapped between a rock and a hard place, technology can show us an escape route. Technology brings efficiency within budget so that hospitals, doctors and nurses never have to compromise treatment for money. But the transition is never easy. When hospitals need to introduce new technologies, it means new methods and new skills as well, and all stakeholders need to be on board. What would that transition look like? This is what we're going to discuss today with Ard Skarlovec. Good morning.
Good morning, Alistair.
Now, we know that hospitals are struggling to deliver services within their budgets. How bad is the situation?
Last year, there was a cost increase in hospitals to hire external personnel from €325 million to €381 million. And in addition, 2 hospitals had to close their doors because they could not stay within budget. These are just some data coming in from the Netherlands, my home country. And the background and the main reason for this is that we have a shortage of personnel in hospitals. And that is caused by the aging of people, which is also causing the aging of the workforce, putting a lot of pressure on those who have to provide the healthcare service.
What can we do to, you say we don't have enough nurses and doctors and things, so what can we do to effectively get more out of them so they can actually run their errands and perform their tasks maybe a bit quicker and therefore do more of them?
Yeah. With individual healthcare costs rising and potentially crossing an average household income, in combination with a lack of staff in hospitals, there is no choice but to look at technology in order to improve the quality of care. And also to consolidate the costs. What Advantech tries to do is that we try to improve work processes in terms of time and efficiency, but also in terms of minimizing risks and therefore better health outcomes.
What is it that you're doing at Advantech? Give us an idea of what your solution is and how you're helping.
Now, we have, for example, a self-service vital sign measurement kiosk. That's a mouthful. But basically, this is a solution we provide in an outpatient department. And this can potentially save hours of work for the nurse. Let's say that an average outpatient department takes care of 200 patients every day. These patients come in due to an appointment or they come in for a day treatment. And prior to their appointment, it will be a standard procedure for a lot of nurses to take the vitals of the patient. And this will take 3 to 5 minutes per patient for a nurse. And with 200 patients coming in every day, this will create a lot of work. This kiosk will take over the complete process from the nurse. The patient can simply go to the kiosk, sit down and follow the instructions on the display in front of them. And the vitals will be measured and it will immediately be uploaded into the electronic health record system. So that is one of the solutions we can provide. Another solution we can provide is called RTLS, Real-Time Location Service. And this can be divided into separate solutions. For example, a solution where the hospital can use that for locating mobile equipment, for example. It could very well be that a hospital is using 200 medication cards and 100 mobile workstations. And in order to be fully aware of the whereabouts of all this equipment, we can provide this by providing the RTLS solution. Another solution which this application can provide is the patient journey. We can provide full insight in the patient journey because we can provide insight in how long the patient will stay in one department before the patient goes to another department. And it simply works by placing tags on either the patients or the mobile equipment. And with the help of Bluetooth technology, all data will be uploaded into a server, after which it will be visualized and analyzed in a central command center. So that is how we basically work.
Let's fast forward and look at hospitals in a future digitalised world. What role do you think they'll play?
I would say that hospitals will move from being a treatment center to more of a communication center. And I even believe that hospitals, some hospitals will be even patient-less. So there will be no patients in hospitals even. But there's still a long way to go. I would say that hospitals also need to change something, because at the moment we have an electronic health record system. And this is basically a very siloed system, only accessible by hospital staff. This electronic health record system needs to open up. It needs to become interoperable. It needs to be able to connect with the systems and databases behind the wearable technology in order to take full profit of this technology. Patients will take full ownership of all medical related data in the future due to GDPR. In case of an alarming situation, the hospital will be alarmed, but also the family members will be alarmed. And everything from that moment on will be focused on solving the situation on site. And if the situation really escalates, okay, then an ambulance will be dispatched to pick up the patient. That is more or less the model we are going into, I think.
For any key stakeholders who are watching, key decision makers, what main takeaways would you like them to remember from this interview?
I would say that a hospital needs to consider for sure how to open up, how to connect more with the community. Second, they need to embrace technology. Because there is simply no other answer than technology to improve the quality of care and to consolidate the costs. And last, I think hospitals also need to take a look at their organization structure, because a structure or an organization structure into separate departments will not work if you try to improve the complete patient journey and to make it much more efficient and also minimize the health risks.
Well, when hospitals are under the immense pressures that they are at the moment, they need to be looking at everything, and certainly technology seems to be able to provide many of those answers, so we can move to a more effective healthcare system in the future. Some exciting times ahead. It's been great finding out more. Thank you so much indeed for coming in. Ard Skelevik from Advantech, thank you very much indeed.
Thank you, Alistair.